Welcome back to Table Talk. Thank you for coming back to the table with Miss Ann Stamps from the Suicide Prevention Network. Ann, we've had a lot of good discussion so far about warning signs and risk factors and some of the different demographics that could be considering that option. Let's talk about some of the resources that the person considering suicide has. And then the family, what resources they have for support.
Okay. We have a nationwide talk line, 1-800-273-TALK, T-A-L-K. In our area, we have mobile crisis unit, and the number is 1-800-704-2651. TSPN.org is a wonderful website to go to. I brought some brochures and laid on your table today. There's resources there with warning signs, what risk factors are, other avenues of help besides the talk line, the crisis number, resources specific to the regions in the great state of Tennessee. We have our own resource directory here in the Upper Cumberland that have local hospitals, counseling centers, community mental health agencies. There's a depression screen that can be accessed through that. So we do have a lot of resources. We need to make sure that everyone is equipped with those, because you may never know when that situation may arise that you may need to rely on one of those resources. Going to the local ER is always good. Calling another friend or a family member that can assist, you know, if you feel like you need to have a conversation with that person. And then, of course, the 1-800 numbers.
Right. It may just be a phone call to a friend or family member to come sit with you for a while and kind of be there with you and talk you through it, rather than, you know, sometimes you maybe don't have the resources right then to go somewhere, but especially an elderly person, but can certainly make a phone call to a friend and have them come over. And as you said, lots of good pamphlets and stuff. Now, I know Warren County and Van Buren County are serviced by Cheer Mental Health is a great resource that we have. What about, are you aware of like White County? Do they fall into the Cookeville area?
I guess it kind of depends on what, you know, part of the county, but there are local community mental health centers in most of our counties, or can be serviced by those. You know, there are also private counseling centers, primary care physicians, you know, that folks go to on a regular basis.
True.
They can address concerns that they have with them as well.
Let's talk too about the stigma. We've touched on it, but the stigma associated with suicide, with the family of someone who has committed suicide, and even mental illness.
Suicide and mental illness are very complex situations and problems and layers. And we find it difficult to talk about both of those things for a variety of reasons. But I think it's important that we have those conversations and make sure that folks understand that it's okay to have those feelings and to be able to find the help and the resource that they need for those feelings. When we talk about mental illness, for such a long period of time, it was viewed as a weakness or a character flaw, poor upbringing, you know, those kinds of things. But we know now through research that mental illness is a biologically based brain disease. So we have to treat it and talk about it just like we would a physical health issue. You know, we don't have a problem talking about diabetes or heart disease, and so we shouldn't have a problem talking about depression and anxiety disorders and those kinds of things, because it is biologically based and it can be treated.
Well, and I feel like there's even still a stigma out there to taking medication for these things. We're kind of in a bit of an area where, because of people taking too much medication, that there's a stigma to that. Oh, they're on meds, or they have to take something to make themselves happy. But it's essential medication for a peaceful and happy life for some.
Yes, with some folks, medication is necessary. Best practice would have medication management and counseling so that you could equip yourself with coping skills and know times when you may be decompensating. It's very important that the person, as well as friends and family, can recognize that too. Because with some of our mental illnesses, especially depression, those signs tend to be more gradual, a gradual onset as opposed to just, immediate. And so sometimes it makes it difficult for us as an individual and our friends or family to notice those because they are so gradual.
It could be, I think of maybe people as they get older, they become a little bit more difficult to deal with, and you can tell they're not quite as happy in life. They didn't start off in their 20s and 30s that way. As you said, it's kind of a gradual thing, and we don't really see that as a warning sign as we should.
Right, and I think that's why, and again, I want to thank you for inviting me to your show so that we can discuss the issue of suicide and mental illness and those warning signs, because those are very important for us to know for ourselves as well as for our friends, family, and other people in the community.
Well, let's talk just one more moment about mental illness. As a family member or someone, a loved one or friend, if you have someone that is mentally ill but does not want to take treatment, they're always up and down. What do you do for someone like that? What's a resource for them?
I think you continue to be persistent and consistent in trying to provide them resources, provide them education, let them know that there are other people that also have mental illness, that they aren't alone in that struggle, and that there are places where you can receive help, because help is available in our area.
When I was reading a little bit about it, it really hit home when I read that these people have kind of been labeled as crazy, and we throw that term around kind of almost with, we don't mean to be cruel, but it kind of is a little bit cruel because there's such a stigma to that. But mental illness, to me, is not crazy. That's just a shaming word, seems like.
Exactly, and we don't need to use those kinds of terms because, again, it is biologically based brain disease. So, we prefer to say mental illness as opposed to any of those,
derogatory terms. Yes,
exactly.
Yes. Let's talk about, seeking help. We'll kind of revisit some of the resources and things, and that it's, okay to talk about it.
It is, and it's important for us to talk about it. One of the colleagues that I work with in Cookeville, she has 2 young children, and she's talked to them about suicide because unfortunately they had a classmate that died by suicide. And so I feel like it's important for us to let people know, it's okay to feel this way. And when you feel that way, you need to seek help. And that's for a child or a teenager, we would want to encourage them to seek help from a trusted adult so that we can be sure that they're provided with the help that they need.
Well, you and I talked before the show about the celebrity suicides that are in the news right now, and there's good and bad that goes with the publicity of that. You've got some that it really kind of reinforces their thoughts that they want to do it. But I think on the positive side to that, it can bring awareness, just like this show, talking about how you can prevent that from ever happening. It's such a preventable disease.
Yes, ma'am, it is. And really, it is probably the #1 preventable death that we have in the United States, is death by suicide. And that's through shows like this, awareness, the Tennessee Suicide Prevention Network, which that's where I volunteer. They work across the state to promote education, prevention, intervention, and postvention when needed. I mentioned the website before, tspn.org, where there is a ton of information and resources that are downloadable, printable, where you can hand it out. I have resources in my office that folks can access anytime. All they have to do is email tspn@tspn.org, and we can make sure folks in our area have all the resources that they need to hand out.
One more thing I'll throw out at you before we wrap up. We haven't really touched on teen suicide very much. I feel like, with the information that's out there, our school systems are probably pretty prepared in dealing with this. Would you agree with that, or is it something they still struggle with?
I know that on our advisory council, we have folks that sit from all the departments of the state, and Department of Education is one of those. Staff members and teachers in our county school systems are required to do suicide prevention training every year, so they are aware of that, and I'm very happy, very pleased that that is in the school system, especially with our kids, because you know as well as I do, during the school year, that's where they spend the majority of their day. And so to make sure that we have the resources out there for our schools and staff, not just teachers, but the folks that work in the cafeterias and the bus drivers is very important.
True. And giving their friends the resources to recognize symptoms and the courage, I guess, to talk about those to the person's parents or the teacher. Because as friends, we tend to keep secrets for our friends and not share that they're depressed or feeling bad.
Exactly, and that's why one of the things that's stressed when we talk to our kids and teenagers is, if you hear one of your friends talking about suicide or ending their life, tell a trusted adult. Go to an adult so that an adult can do some intervention there, and call in crisis or family member or whoever we might need to do.
Very good. Well, thank you so much for making the trip from Cookeville to talk to us today. Such good information, and thank you for joining us today. We hope you found the information helpful and to raise awareness of suicide prevention. If you know someone who is troubled with thoughts of suicide, or if you are concerned about a loved one, please contact Help for You, Help for Them, 1-800-273-TALK, that's 8255, or now there's even a texting helpline, a crisis line. You just text TN to 741-741. So that's a great resource to reach out to children, because they're all into texting and things, and they may be more apt to do that rather than call.
Yes, ma'am.
So, well, that's our edition for Table Talk today. Thank you so much, and we'll see you again next week at Table Talk.